Recovery and solidarity trials have reliably assessed the effectiveness of more than 10 different treatment modalities over 50,000 patients. Finland is proud that we have joined the World Health Organization's Solidarity Trial Consortium. We are pleased with the announcement of the beginning of the new phase, the so-called Solidarity Plus trial. It includes 3 new repurposed trucks and brings together more than 50 countries. In Finland, 14 major hospitals have joined the Solidarity trial. On 6th of August, 2 Finnish university hospitals in Tampere and in Helsinki were the first hospitals globally to start to randomize patients to the Solidarity Plus trials. Solidarity and recovery trials have set new standards and have shown that a combination of old-fashioned randomization, established clinical trials networks, and imaginative use of modern information technology are able to provide rapid and reliable therapeutic solutions. In the future, it is important to prioritize large, simple, collaborative platform trials and to enable collaboration between governments, regulators, funders, health services, patient organizations, universities, researchers, doctors, and other stakeholders. World Health Organization plays a crucial role in facilitating such collaboration. We are looking forward to successful outcomes from the Solidarity trial. Thank you.
Thank you, Your Excellency, and thank you for your leadership in advancing research on therapeutics. Kiitos again. One of the strengths of the Solidarity Plus trial is that it's truly global study, with researchers all over the world participating. Today, we're joined by 2 principal investigators in the Solidarity Plus trial, and my friend, Professor Samba Sow, Director of the Center for Vaccine Development in Mali, and Professor Marco Medina from the National Autonomous University of Honduras. Professor Sow is also WHO's Special Envoy for COVID-19 in Africa. Samba, thank you for your leadership in the pandemic, your participation in Solidarity Plus, and for joining us today. You have the floor.
Thank you very much, Dr. Tedros, Director General of WHO, and my dear friend and brother. I want to start by thanking WHO for their leadership and visions, not only with the Solidarity trials, but with the pandemic as a whole. They have fought for global solutions to what has been undoubtedly one of the most troubling global issues of our times. When the pandemic started, there was a lot of concerns that Africa could become an epicenter to this awful virus due in no small part to its fragile health systems. But despite the frightening 3rd wave, which is occurring now, and the lack in so many countries of accurate reporting and enough testing, the pandemic has not impacted Africa in the ways which were expected. That is not to say that Africa is still not at risk. It very much is. We risk losing many hard-fought gains of the last decade through the decimation of essential health services and the economic impact. This is why trials such as the Solidarity Therapeutics trial, the so-called Solidarity Plus trial by WHO, are so critical. In my career in vaccine development and research, I have seen the capacity of African researchers and their contribution now more than ever in solving this puzzle for Africa and the world. I am very grateful to WHO and other partners for seeing this opportunity to build the capacity further and for the investment in doing so. Building this capacity will ensure that we are well placed in Africa to carry on developing the tools, drugs, and vaccines which are so needed for now and in the future. To end, I will say the truth is that in the global fight against infectious diseases, a country, even a continent, can never succeed alone. We will only triumph if we stand and work together. I thank you.
Thank you. Thank you, my friend Samba. Professor Marco Medina is also no stranger to WHO. He is a neurologist and director of the WHO Collaborating Center for Research and Community Intervention in Epilepsy in Honduras. Professor Medina, thank you for joining us. We know Honduras is one of many countries now facing an increase in COVID-19 cases and deaths. We look forward to hearing from you about the situation in Honduras and how you think the Solidarity Plus trial can help. You have the floor.
Thank you, Dr. Tedros Adhanom, Director General for the World Health Organization. Dear all, it is a great honor to participate in this important meeting announcing the next phase of solidarity called Solidarity Plus. The National Autonomous University of Honduras, a WHO collaborating center, the Honduras Ministry of Health, and the Honduras investigators in 6 hospitals in our country have participated in the first Solidarity trial in collaboration with 30 countries around the world. And now we are working with investigators from 52 countries in this second phase under the leadership of the WHO. The leadership of the WHO in this project has been fundamental, and the first trial was an extraordinary achievement where hundreds of investigators around the world were working globally to evaluate an effective treatment for this pandemic of COVID-19 and represented one of the largest international randomized trials around the globe. During this project, we have gained a lot of experience, and we are strongly believing that the next phase will be a success to find a treatment, a major treatment for this disease. Our national experience has been an important tool for promoting local research capacity. Collaboration at the regional and global level is also an extraordinary achievement and a crucial step to find therapeutic answers to this terrible disease. In Latin America, in Honduras, we are facing a major problem for this disease, and finding a cure for this problem is crucial, but as well as the vaccine access is also another answer, and improving the healthcare in our region is an important step that we need to work. We would like to congratulate the World Health Organization for this major global initiative, and we are looking forward to work with you in the future. And thank you very much for this invitation.
Thank you, Professor Medina, and thank you to all our guests today, Minister Sarkkinen, Professor Samba, and Medina. And we welcome your engagement and support. My sincere hope is that one or more of the drugs being tested in the Solidarity Plus trial will prove to be effective in treating COVID-19. WHO remains committed to working with you and with all of the researchers and patients in the trial to advance the science, find new solutions, and to do it all in solidarity. Tariq, back to you.
Thank you, Dr. Tedros, and thanks to our distinguished guests. Hopefully they will be able to stay with us and answer any possible questions from media. So now we will open the floor to journalists. You need to click icon raise hand, and also as always, and thanks to our interpreters, you may ask question in 6 languages plus Portuguese and Portuguese only. With that, we will start with the first question. That's Kamran Kasimov from Real TV from Azerbaijan. Kamran?
Do you hear me?
Yes, very well.
Hello, greetings from Azerbaijan, from Real TV, and thank you. I have a question. We see every day, every month, we see new stands of coronavirus every month. Will these drugs, I mean Solidarity Plus trio, resistant to the new types of infection in future? Because every month there are new types of coronavirus, COVID-19, Delta, Alpha, and another. Thank you.
Kamran, can you just please say it one more time and slowly? Sorry for this, thank you.
About the Solidarity Plus trio, yes? And every month we see new stamps of coronavirus. Will these drugs from this trio resistant to the new types of infection in future?
Thank you, Kamran. I think the question is these new drugs entering the trial and the variants, and will these drugs be effective against variants?
So perhaps I'll start, and then I'm looking to Anna Maria and Mary Pierre if they would like to specifically address the Solidarity Plus trial. So I think this is a very good question, the question about whether or not the therapeutics that exist will work against the SARS-CoV-2 virus and the variants of concern, the variants of interest that are emerging. And I think this is why we have these trials. This is why we have these collaborations around the world that are trying to consolidate and pull together as much information as we can, almost in real time, to indeed answer the question that you've asked. Do the therapeutics work? Do the diagnostics work, to be able to detect cases? Do the therapeutics work to prevent severe disease and death? Do our vaccines continue to work to prevent severe disease and death? And this is why we have established all of these studies. This is why we have established these global collaborations and these regular consultations to gather that information to answer that question. So there will be more variants. The virus is evolving. It continues to evolve every day. We have 4 variants of concern that we are tracking. There are 4 variants of interest that we are tracking, and many more alerts that we have on our radar, in which we are looking to see, what will happen. So it's a good question. I don't have an answer to that, but I think what is important is that we have a process in place to be able to get those answers relatively quickly. Anna Maria?
Yes, thank you, Maria. We totally agree with the question being important. What we are doing is we have an independent panel of experts. They continuously review the evidence that emerges on potential treatments, and we continue to ourselves through the Solidarity trial, but also to our collaborations with other trials around the world, try to gather information on whether or not the treatments we are using now or the treatments we are evaluating in the trial lose their effectiveness because of the variants. So far, we have no evidence to ascertain whether or not that is the case. And in the case of the 3 drugs in the Solidarity trial, as Maria just said, as Dr. Bankerkova just said, this is why we are doing the trial, to ascertain if these drugs indeed have an effect on the duration of hospital stay, the need for ventilation and mortality in the context of the circulating variants.
Yes. And just to add to these very important remarks, that this is precisely why solidarity trial is so important, because with such large platforms, it's the only way that we can get to the answer as fast as possible. And also with the geographic span, as you mentioned, there are many variants, and those variants can appear anywhere on the planet. And so having so many sites in so many different countries and regions will help us get to these answers as fast as possible.
Thank you, Dr. Preziosi and Dr. Hanna Sarkkinen. Dr. Mike Ryan would like to add something. Dr. Ryan.
No, I think the question raised is also very relevant in terms of treatments for emerging diseases. We've just had the Director General speak about Marburg disease, for which we don't have specific therapeutics. And this is always the case when we have new diseases emerge or new variants emerge. Right now, we're dealing with the therapeutics in the area of COVID or any disease. Right now, we have things like oxygen and supportive care, which is really important in all emerging diseases. That's where we start. Then we have the drugs that modulate the immune response. You've heard about the different steroids, dexamethasone, which help reduce inflammation. Then we have specific antibodies that can be developed, hyperimmune globulins or monoclonal antibodies. And they're essentially giving a person an antibody boost to fight the specific virus. And then there are specific antivirals, usually small molecules that interfere in some way with the virus and its reproduction. So there are 4 potential targets. And we're always behind the curve when it comes to an emerging disease because we're always starting behind the line. And that's why the R&D blueprint for epidemics is so important, and the work that's going on around the world to develop more broad spectrum antivirals, to be able to develop monoclonal and polyclonal antibodies quickly, to be able to deploy and know how to use steroids and immunomodulators, things that modulate the immune response, be able to use them, and also getting people access to higher standards of care, basic oxygen and intensive care. So it's a combination of all of these things. And it's really important we learn the lessons now in COVID, because we're starting with Marburg and we don't have the necessary tools. And we have to start learning how to develop these tools in advance and have them ready to go when we see these diseases emerge. And I think there are many lessons being learned. And I think it's really testament to all those researchers around the world in all those countries who are working with WHO and our partners to deliver on these platform trials that give us the power to be able to test many drugs at one time, many different kinds of intervention.
Thank you, Dr. Ryan. We will go now to next question. That's Elizabeth Isakova from RIA Novosti. Elisa, you have the floor.
Yeah, hi. I have one question and one small remark. First, the question, do you have any additional information about the new Iota variant that was announced, that was found in the United States? How worried are you that this variant of interest may become soon the variant of concern? And how worried are you? Is it true that this variant is more contagious and more dangerous than the Delta variant? And the second small remark is the question, do you have any updates, information about the Sputnik vaccine? Because the latest update that we can see on the website is from 15th of July. So maybe you have some more information about the documents and maybe the data of the decision on Sputnik. Thank you.
Thank you. Thank you, Lisa. Maybe Dr. Van Kerkhove can start on variant and maybe Dr. Simao can add on the vaccine.
Thanks, Tarek. Thanks for the question. So on the first part of your question on the Iota variant, this is the B1526. This is a variant that has been classified by WHO as a variant of interest. It was the first documented samples we have of this variant of interest come from the United States in November 2020, and we designated this as a variant of interest in March 2021. There are about 28,000 full genome sequences on GISAID of this Iota variant. About 27,000 of those, more than 27,000 of those, are actually from the United States. There's some very good research that is underway on this variant. There's some preliminary data from New York that found that the Iota variant did not lead to more severe disease, and it was not associated with an increased risk of breakthrough or reinfection. So that's some preliminary data that came out there. I think what is important as we look at these variants is we look at the circulation of them. Our understanding of the circulation of the Iota variant, that the prevalence of Iota in the United States, where much of the variant has been detected, is actually decreasing. And the variant Delta is actually increasing. And so the Delta variant seems to outcompete the Iota variant in terms of circulation. And I think globally, if we look globally, more than 90% of the sequences that have been submitted to platforms like GISAID have actually been of the Delta variant. So of the variants that we are monitoring, and as I mentioned previously, there are many, we take all of these very seriously. Currently, the Iota variant is a variant of interest. We are actively monitoring this one, as we are all of the other variants of interest and concern, to look at the data that's coming out. But as we understand, the Delta variant seems to be outcompeting the Iota variant.
Thank you. And apologies, because actually that list that you saw on the website that says 15th of July, it's actually up to date, and it's updated every week, so it's the wrong date. But let me say that the Sputnik, the process is still ongoing. We have some legal procedures undergoing at the moment, and we don't have a date to finalize the assessment. But I do have good news, because we have started the assessment of Bharat, which is the Covaxin, in July, and it's very advanced. We expect that we may have news about a final assessment beginning of September, mid of September. And we also have 5 other vaccine candidates that are beginning the assessment, 3 now in August. Sinopharm from YIBP, which is Sinopharm in Wuhan. We already did the listing for Sinopharm in Beijing, CanSino, and SII Novavax, the Serum Institute of India version of Novavax. And for September, we are expecting to have the Sanofi Pasteur and the Novavax, the main dossier being starting the rolling submission. So there are many vaccines at the final stages in the pipeline. So that's good. Thank you.
Thank you very much. If we could just really limit questions to only one, so we can take as many as possible, because we have a long list of journalists online. We will now go to Miguel Ángel Criado from El País. I understand that Miguel could ask his question in Spanish. Miguel, you need to unmute yourself.
¿Se oye bien ahora?
Sí, sí, te escuchamos.
A los panelistas, ninguno de estos está destinado para ir contra el coronavirus, sino más bien para intentar suavizar la respuesta. ¿Me oyen ahora?
Miguel, unfortunately, you are broken. We can't hear the question, so we may come back to you in a second. Let's get to Gabriela Sotomayor from Proceso from Mexico. Gabriela.
Hola.
Hola.
Hola. Hi. I'm back. Nice to see you again. And I wonder when we can attend press conferences in person like before. So I just heard that. One question by person, but I wish to ask 2, but okay. My first question. The case of Tanzania is very surprising for me, with 1,367 cases and 50 deaths so far. I read that every Sunday, a large number of people take a medicine against malaria as part of their habits to avoid that disease. So I wonder if the medicine has something to do with the low number of COVID cases. And if I can ask a second question on Mexico. Mexico is increasing the cases with the Delta variant. About 22% of the population has complete doses of the vaccine. So what can be done to avoid scenarios such as those in Brazil or India? 40% of the population has 1 dose. So that's my question. Thank you so much.
Thank you, Gabriela. We also hope to see all of you soon. Maybe Maria can start.
I will start, and I'll choose to answer your second question around Mexico. And Gabriela, I'll just like to say I hope we get to see you again in the near future, as well as the other Geneva-based journalists. So with regards to Mexico, I'm looking at. I mean, I think you'll know what my answer will be in terms of a comprehensive, approach that Mexico is taking, and that Mexico needs to consistently and continue to be vigilant against. So the vaccination coverage is increasing, as you've pointed out. Many have 2 doses, some only have 1. So increasing the coverage of vaccination and the full course of vaccination will certainly help in terms of reducing severe disease and death, and will likely have an impact on transmission as more of the population becomes vaccinated. But of course, it's vaccines and all of the other measures as well, not just vaccines only. So continuing to make sure that there is strong, robust surveillance, that there's good testing, and that testing, those results come back quickly and are lead to action. And so we've seen, across the country, there have been different peaks. Those peaks have been driven down, and it certainly can be done again, especially in the context of the additional tool of vaccines and vaccination. And so it's staying the course. It's really making sure that there are consistent approaches, that the use of these interventions are tailored and targeted, time-bound to where they are most needed across the country, making sure that the population is well engaged and they know what to do. We need everyone on the planet to really understand how they can play a role, positively or negatively. And I think part of the Director General's message today about all of us being in this together, but we're not really acting like we're all in this together, is true around the world. And I think it's really important that from WHO, it's very clear that we want everyone to play a part in this these control efforts, and they can at individual level measures of continuing to wear your mask, avoiding crowded spaces, spending more time outdoors than indoors, washing your hands, getting the vaccine when the vaccine is offered. There are many people around the world who do not have access to the vaccine, who have not been offered. So when it is your turn, please take that turn and continue to have that. Make sure you have the full dose. But it's about doing it all and making sure that we stay vigilant. Thanks.
Thank you. Would someone like to maybe try to answer the first question on malaria drug that is being used in certain countries?
Yeah, I want to reiterate what we said just now, that we have an independent expert group that helps WHO to review the evidence of all the emerging drugs and treatments that are available. And as they become promising based on the data, then we consider them for the therapeutics trial, the Solidarity Plus. In addition, WHO has another independent group of experts that routinely review the evidence on drugs for which there is information from phase 3 clinical trials and beyond. And this independent committee also helps WHO to formulate the guidelines that will be used to improve or to adjust the current clinical management of patients with COVID. So any drug that is being tested or used through a clinical trial or through an observational deployment in a country is of interest for us. We always review the evidence, and as the evidence helps us make conclusions and our experts give us recommendations, we take them up. Thank you.
Thank you. Dr. Ryan would like to add. Dr. Ryan?
Yeah, no, just to follow up on Anna Maria's point, which is very well made. In science, very often we make observations. We observe that certain things happen. Clinicians or doctors observe that a certain drug has a certain effect. Communities notice that something may be working at community level. But they're observations, and they're full of biases, because we have many biases that drive how we look at data. And that's why it's so important that when we get these positive observations, that we do the trials necessary to take all of the biases out. So, for example, in the case of a community taking a certain drug, that drug may be effective or not effective, But it may also reflect the fact that a community is more vigilant because it's more committed to disease control. They may be physically distancing more. The people may be more careful. They may be washing their hands. They may be a community that has a higher level of commitment to controlling a disease. It may not be a drug that's doing the reducing the incidence of disease, but many other factors. And that's what good clinical trials will do. They will standardize all of those factors and then come up with answers that tell you exactly what a particular drug is doing within a particular patient population. And again, we need these clinical platforms to be able to do these kind of large-scale trials across a range of countries, so that these type of research has not been just done in one place in the north, but it's spread around the world, that everyone is contributing to the research and everybody is benefiting from the outcomes of that research. And the Director General, Dr. Tedros, has said this for a year and a half now. This is about science, solidarity, and solutions. We need both. We need the science, we need the solidarity. That will drive the development of solutions. It is always positive to hear positive news where communities or doctors or people have observations, because the essence of progress is to observe something changing and test whether that's actually happening. And that is at the core of what we're trying to do as scientists around the world.
Thank you, Dr. Ryan, Dr. Restrepo, and Dr. Van Kerkhove. Let's move to next question. Sarah Newey from Telegraph. Sarah?
Hi there, thank you very much. I'm sure you've seen there's lots of discussion ongoing in the UK, at least at the moment, about whether herd immunity is now unachievable because vaccines don't appear to halt transmission as much as hoped. I just wondered what you think of this and how this might affect the trajectory of the pandemic. How big a problem would this be? Thank you.
Thank you. Okay, so let's Kate O'Brien, if Kate is online. And Dr. O'Brien, can you take this question?
Yeah. Thanks for the really important question, and one that countries around the world are asking, and one that at WHO we're looking at very carefully and monitoring the evidence around this. The issue of herd immunity is an important one. It's really the observation and the effect of added protection beyond that you would expect simply attributable to the number of people or the proportion of people who have been immunized in the population. So it's sort of that added impact of a vaccine program, because the people who are not immune, because they haven't been able to be vaccinated, are embedded among and within groups of people who already have been vaccinated. So it makes it really hard for a virus or another pathogen to move from one person to another. And those people who aren't protected directly are nevertheless at reduced risk of disease. There's no magic number at which the proportion of the population who needs to be vaccinated, there's no specific number, some magic number that needs to be achieved. It really is related to how transmissible the virus is. So we know for measles viruses, for example, which are highly transmissible, that we need an enormous fraction of the population to be immune or to be vaccinated and immune through that mechanism in order to achieve that protection of the unvaccinated or non-immune people, somewhere around 95% of the population. And what's been happening with coronavirus for the SARS-CoV-2 virus is that as the variants are emerging and are more transmissible, it does mean that a higher fraction of people need to be vaccinated in order to likely achieve some level of herd immunity. So this is an area of scientific uncertainty. It's an area that we're watching really carefully. The studies to evaluate the magnitude by which the vaccines are preventing transmission and not just disease are really important studies. They're difficult studies to do, and we need those studies variant by variant, and we need them vaccine by vaccine. So I think the general wisdom and the general assessment is that as the SARS-CoV-2 variants are increasingly transmissible, and as they're emerging and transmitting around the world, that a greater fraction of the population needs to be vaccinated in order to affect some degree of herd immunity. So the most important thing at this point is to get on with the vaccine programs at the highest degree of equitable distribution possible, because the primary target is to prevent serious disease, hospitalization, and death. That's the primary objective of these vaccines. And we have a panel of vaccines that are really, really effective at doing that. And it is the equitable distribution so that those kinds of serious outcomes of infection are prevented in every country around the world, even as we continue to pursue ever greater coverage with vaccines to try to reduce the transmission. But we don't have vaccines that are highly effective at reducing transmission. And so this interplay between the viruses, their evolution, and the vaccines is going to continue to play out. And we really have to focus on that severe disease spectrum end, along with assuring that we are not taking our foot off the pedal of the other interventions that work to reduce transmission: masking, hand washing, distancing, not being in large gatherings of people. All of those things, it's vaccines and those things, are going to address the transmission while vaccination coverage increases. And we will find out to what magnitude coverage needs to be in order to try to get some level of herd immunity.
Thank you, Dr. O'Brien. And obviously our guests, Minister Sarkkinen, Director Samba Sow, and Mr. Marco Medina, are welcome to add to any of questions, their thoughts. Just make sure that you let us know, and we will put you online. Next question is from Kai Kupferschmidt from Science. Kai?
Hey, Tariq, thanks and congrats on restarting Solidarity. I just wanted to ask for a few more details. Can you give an idea? So Finland was the first country to start. How many countries, already have the drugs in place and all the necessary approvals? Basically, how many countries? How fast do you expect it to ramp up? And the other brief thing is just, I understand that Finland isn't testing artesunate. And I'm wondering how many other countries are not doing that. Is that just Finland, or are there several countries?
Okay, so Kai, thank you very much for your question. These are two important questions. So number one, the trial, that is a platform trial, as we have discussed, involves countries and hospitals in many settings all around the world. It is organized as an adaptive design trial. It is adaptive also in the choice of the treatments. So if the treatments are not approved by the regulatory authority of the given country to be included in the trial, or at the point in time during the randomization they are not available in a given hospital, the platform we use allows the clinicians to proceed with the randomization, and it continues to be a randomized trial with a strong evidence being generated. That's the first thing. The second is that we have, as Dr. Tedros mentioned, 52 countries in the trial. The process of approval, regulatory and ethical, changed from country to country. In the middle of the pandemic, many countries have accelerated the process, but still there are differences. Some of the countries have already obtained the approvals, and as they obtain the approvals, including the import permits for the admission of the therapeutics in their country, we proceed with the shipment. And my colleague, Dr. Marie-Pierre Preciosi, will provide some additional specific numbers. Thank you.
Yes. Thank you very much for your interest. So just to confirm that with 52 countries, as you can imagine, we cannot have all 52 starting at once. However, we can today say with confidence that half of them have already obtained all the ethical and regulatory approvals. But we need more because as a global sponsor, we need to have the evidence of all the submissions. We need to go through all the details, the training, to make sure that they all implement the trial correctly and according to protocol, and to support them in their preparations. So to be a little bit more specific, we have at least 10 to 15 countries for which the drugs have been shipped or are under shipment already today. And the last point about selecting the drugs, so almost all countries are going for the free drugs. We have a few exceptions here and there because some regulators have made the judgment that they would not like to approve one or the other drug to be included, but this is very rare. So we don't anticipate that this will be the rule. Thank you.
Can I add? I just want to add to the question on the speed of enrollment, that this time, as we say, we have 16 more countries and nearly 200 hospitals more in the trial. We are very, very, very grateful to the researchers in all these countries. This will allow us to have an even wider capacity to recruit patients with COVID if they consent to participate in the trial. So if anything, we are hopeful that the recruitment rates will be higher, much higher than in the initial phase, because unfortunately, COVID is still a very common disease in many parts of the world. Thank you.
Thank you very much, Dr. Preziosi and Dr. Restrepo. We will now move to Helen Branswell from Stats. Helen? Do we have... Hi, Helen.
Yeah. Hi, thanks very much, Tarek. At the beginning of the press conference, the Director General was mentioning the Marburg outbreak and talked about the R&D blueprint. I'm wondering, of the various candidate Marburg vaccines, is there any for which there are enough human-grade supplies that they could be put into use in a clinical trial if the need arises? Thank you.
As Dr. Ryan mentioned, we are very aware of the importance of being prepared and planning in advance. So with Dr. Preziosi and other colleagues in the R&D blueprint, we have developed over the years what we call research and development roadmaps for each of the priority diseases of the R&D blueprint, including Marburg. As part of this work, we have identified some candidate vaccines that are under development. Specifically, we know that there is one candidate vaccine that has good data in preclinical phase, meaning when it's tested in animals. And this phase is very important because it provides the developers information on whether or not the vaccine actually induces an immune response, protects the animals, and is safe. And following that, this vaccine also have information on safety in humans and some initial very good results on immunogenicity. There are other candidates. So as we speak, we are actively engaged with the developers. We are discussing the possibility of testing these vaccines in the field in this rare outbreak of Marburg. And we are committed, as we have done work for other emerging infectious diseases, to try to accelerate the evaluation of any life-saving vaccines and treatments.
Thank you. Thank you, Dr. Restrepo. Dr. Ryan, would you like to add something?
No, I think you have Dr. Sosa there. I think it's, for me, that work is very important, but also the fact that these diseases are getting picked up quickly in the field, single case. We're not talking about a major cluster of disease. A lot of deployment of surveillance, contact tracing, follow-up, identifying people at risk, shoring up and improving infection prevention and control. And Marburg is a disease that has been known to transmit in labs, transmit in hospital environments in particular. So it's really important that the work on the ground contains the disease, and the DG said it. That's what we're doing, the same basic stuff: surveillance, case finding, contact tracing, following up contacts, ensuring that people who get sick are rapidly isolated and given the appropriate standard of care and level of care. And even without specific therapeutics or vaccines, we can save a lot of lives with a high standard of clinical care. And it's really important, as Anna Maria said previously, that people come forward for that care. So there's a lot of work on the ground in responding. The authorities in Guinea now, and particularly in Geka, do have obviously the 2014 experience and the recent experience of Ebola containment, which they did very well. And again, we're getting better at, number one, picking up these diseases, two, getting them reported into the system, and three, being able to initiate containment measures, usually driven by the national authorities on the ground reacting and investigating. If we link to that all of the R&D, research and development blueprint for epidemics work around the world, with all our partners, and we can connect both those global solutions with those local capacities, and that's the trick. The trick is to recognize that we need local infrastructure, local workforce, astute, well-trained clinicians and nurses who notice when something is wrong, when they have an unusual case or a cluster of disease, and that they know what to do. They can take a sample, get that sample tested. These samples were tested in Guinea, then confirmed at a reference lab in Senegal. These samples didn't have to come to Europe or North America because the capacities now exist in Africa to do this work, really high quality work. Samba Sow is on, Samba and other people have been instrumental in developing these capacities in Africa. So we really have to build that infrastructure, the human infrastructure and the physical infrastructure. And then we need to connect that infrastructure and those people with global solutions, global research, global innovation. The two together give us the answer.
Thank you, Mike and Maria. I think we need really to congratulate the team in Guinea and in Gekedo, because you may recall that a few years ago we had to send sample to Atlanta or Lyon to confirm Ebola or the diseases. This time it was confirmed in Gekedo. Thanks to the investment we have done in terms of preparedness. It's true that it's the first Marburg outbreak in West Africa. But in our risk assessment of heightened pathogen, we have identified more than 20 countries in Africa where transmission of Marburg virus disease can happen. Although before Guinea, we have only had 5 countries that reported real outbreaks. So we need to do more in terms of investing in local surveillance, as said by Mike, not only for Marburg, but also on research and development for other so-called viral hemorrhagic diseases like Lassa, because Lassa is very prevalent in West Africa and many other African countries, Cayman Congo virus diseases, Rift Valley fever, and so on. That's why this investment, research and development is critical, and with more investment done during COVID-19, we expect to use this momentum to be more ready and prevent more people from this heightened pathogen. Thank you.
Thank you, Dr. Sosefal. We will have time for 1 or 2 questions before we ask our guests to give their final words, as well as Dr. Tedros. So let's go to Sophie Mokena from South Africa Broadcast Corporation. Sophie, the floor is yours.
Thank you so much. My question revolves around the issue of stigma. As we see more countries administering the vaccine, particularly in the sub-Sahara region, there's now a growing trend where those who are vaccinated are kind of not comfortable to interact with those who are not vaccinated. And we had this problem during HIV and AIDS, where people who were positive were being stigmatized. What is the position of the World Health Organization? Because we see the similar reaction in other regions of the world.
Thank you, Sophie. Maybe Bruce can start and then Maria can add as well. Bruce, would you like to take this one?
Sure. Thank you very much for the question, Sophie, and thank you, Tarek. I think one of the most important things refers back to a theme that the Director General and that Mike have spoken to repeatedly, and that is the issue of solidarity in the response to COVID-19. And we're in this, as we said, together, whether people are vaccinated or unvaccinated. We need to make sure we're putting in place the same measures to protect the entire population, the same social distancing where appropriate, the same masking where appropriate, et cetera. But, the goal is with vaccination that we can eventually get to the point of reopening societies, reopening economies. And in any situation, there's always going to be a mix of vaccinated, unvaccinated. The goal, of course, is to get as much of the population vaccinated as possible. But again, we would really want to minimize and avoid any stigmatization whatsoever of people, whether vaccinated, unvaccinated, because it will simply be one more barrier to the solidarity that's going to be key to how we operate as societies, how we operate within the health profession to get out of this crisis.
Thank you, Dr. Aylward. We will now ask our special guests for some final remarks, and we will start with the Minister Sarkkinen, Minister of Social Affairs and Health from Finland. Minister, please, the floor is yours.
Thank you very much. I would just like to add that important aspect in the Solidarity Plus is that it is simple to participate for the hospitals and for the doctors and for the teams, and it doesn't create much extra work in the treatment of patients. So I think this is an important aspect of the Solidarity Plus, and also key for that we have been able to make it so popular in the Finnish hospitals and in the Finnish healthcare. But in the end, I just want to thank the World Health Organization for its leadership in the COVID-19 response and creating this very important platform for the global cooperation and solidarity. Thank you very much.
Thank you very much, Minister, for your participation in today's event and for your work on Solidarity Plus trial. Mr. Samba Sow, Director of Center for Vaccine Development in Mali and National Principal Investigator for Solidarity Plus trial, you have the floor for some final remarks.
Thank you very much. I would like to thank WHO for organizing this important press conference. And I would like to also thank the speakers, starting with the DG for inviting me, and thank to the Minister and to Professor Marco and to all of the speakers. This is a very, very important way to go with this pandemic. As the DG used to say almost 2 years ago, no one can do this alone. This is global. We have to go together. And this is one of the great examples that WHO is showing here, involving places, as Dr. Sose said, 2 years ago, I shipped the first Ebola samples with Dr. Sose himself when he was WHO rep in Bamako, Mali. We shipped together the first 2 samples to Atlanta. But today, I can test that in my own lab. Today, we can test COVID in my own lab. So this is what we need, and this is Africa, this is the world. So let's continue fighting together. Let's continue to go together, work together for each of the continent and for all of the continent. I thank you very much again for having us. And I will repeat my last sentence. The truth is that in the global fight against infectious diseases, a country, even a continent, can never succeed alone. We will only triumph if we stand and work together. And this also used to be said by the DG somehow at the very beginning. And still, thank you very much for having us. There was one question, so vaccine stigma. I would like just to say this, it depends on the community where you are, on the country where you are. Sometimes if you feel that you are vaccinated and that you have more privilege compared to non-vaccinated, in some communities, when you are vaccinated, you can be rejected for that. So it depends on where you are, and we need to work together. It's a great problem, and we need to work together. We need communication to solve that. Thank you very much.
Thank you very much, Professor Sow, for this very important message and for all your work over years working with WHO. And now going to Professor Marco Medina from Honduras for his last thoughts. Professor Medina.
Thank you very much. We are very proud to collaborate in this important effort on solidarity. I think the team working on this subject has been very effective. For instance, the work of Ana Maria and as well as the experts such as Professor Tito or Professor Miranda in Latin America. I think this kind of a project can be the first step for other projects that we can establish to deal initially with COVID, which is at this moment the most important problem around the world. But in the next future, we can work together evaluating problems that are important for the world. I think the strategy and the technical aspect plus the teamwork has been quite important and improving the local research building capacity. At this moment, we are working on the next step, and the Ministry of Health has been quite interested to promote this project as well as my university. And I think one of the issues that we need to evaluate is to have a constant feedback to our countries, mainly sending a public message about the progress that the WHO is making. COVAX, in my opinion, has been a crucial project as well. And I would like just to answer one of the questions that I was having about the vaccines. Actually, because from the support of COVAX, we got a lot of vaccines, mainly AstraZeneca, Pfizer, and Moderna. But we need to work against fake news. And with PAHO and our university, we are planning to evaluate the impact in our population about fake news that can affect treatment and vaccination. And I think that is an important issue that we need to evaluate. Finally, I would like to thank the leadership of Professor Tedros and the WHO team. I know very well how a strong work you are doing right there with few people working, but together with the people around the world, we can make a great success for against this problem, this major pandemic that are affecting our world. Thank you very much.
Many thanks, Professor Medina, and to all guests online, special guests, WHO colleagues, and WHO colleagues here in the room. As always, we will send an audio file from this press briefing, as well as some video material later in the evening, and transcript will be posted tomorrow. Just a quick word to Miguel Angel from El País. We received your question in writing, so we will try to answer that. Sorry for the bad communication. With this, I will hand to Dr. Tedros for his final words.
Thank you, Tariq. I concur with our guests' closing statements, so I don't have anything to add, except thanking our guests for joining us today. And thank you to Minister Hanna Sarkkinen, thank you to Professor Samba Sow, and also thank you to Professor Marco Medina. Thank you so much. And the way out of this pandemic is, as you have all stressed, working together. So thank you so much again. And thank you also to our media colleagues for joining us today, and look forward to having you in our upcoming presser. Thank you.